What's going on, world? You're rocking with the young man Nuke, and this is Fresh Radio, where I bring you the family revolution, edutainment, spirituality, health, and hip-hop all in one show. So, today is the day that I go about talking about health insurance. And my main reasoning for going into talking about health insurance is basically I didn't know anything about health insurance before I started selling it. And as I started selling it, I realized that there are people who have no idea how health insurance works, how they could access it. Even when they do have it, they have no idea how to read their plans. They just know that they just go to the doctor and they pay their $20 or whatever it is, and and move forward like that. But they don't know how it really actually works and how it can work for them. And I want to take this time. I want to build on that. I want to help those who are out there to figure out how their plans work, how their coverages work. I want to make sure that you have a better understanding on how these things can affect you, how they do affect you, and how they can be affected by you. You dig? So that's what I'm here for at this point. I'm here to just simplify some things for you and not talk all type of sales lingo. I am an insurance salesman, but I don't like selling. I like offering. And if you have a need and I have a product or a service that can help you, I more than likely will try to make sure that it works in your best benefit as opposed to working in my benefit. Because I noticed that if I can help you and make it to the point where I'm helping you, I'm going to get paid, period. And that's on all levels of life. It doesn't matter whatever it is. If you come to me for a service and I honestly feel like I can provide that service at a high level, I know that at the end of the day, as long as I do what I'm supposed to do, I'm going to reward from that, even if it's not monetary. So, this is my way of reaching out to those out there who need help, who need assistance, who don't even know where to turn. And hopefully they can turn to me. And if for whatever reason you've ran across this video and this does not apply to you, man, share this to somebody. Share this video so that they can get into it and they can realize where it is that they need some help with, if they did need help or whatever. So, yeah. I'm going to take this time to go over health insurance basics. I'm not sure how long this video is going to be, but I'm going to try to make it short and concise. And we can definitely get deeper into topics. If you want to make a comment, drop it down below. I definitely want to hear from you on this particular thing. And, answer all any questions. I'll even dedicate a whole show to your question. Trust, we can do it like that. So without further ado, what is health insurance? So health insurance is basically a contract that you go into with a company that you pay. They're called the insurer, and they would help cover your medical costs. Okay. Now, the way they help cover the medical costs could be in one of a couple different ways, but what they mainly do is they help you pay for your doctor's visits, your hospital stays, medications, and mental health services, going to see specialists and x-rays and all of these other things. If you've ever been to the emergency room for a legit emergency, broken bone or stitches or sicknesses or anything like that, and you did not have health insurance, you know that there's a bill that comes after, and that bill is tremendous. Health insurance helps to make sure that bill is very, very, very much so manageable. So I want to start with saying this. A lot of people don't know the terms. What these terms are. So that's what this show is about. It's about health insurance terms. And I want you to know the top 5. I like doing things in 5. But I want you to know the top 5 terms that you need to know on how your insurance works, okay? So the number 1 term, premium. The premium is the amount of money that you pay each month for your health coverage, okay? And this is if you use it or not. You pay for your gym membership, and if you don't go to the gym membership, you're still paying for your membership every month. The same thing with this premium for health insurance. If you don't use the coverage because you are not sick, that does not mean that you don't have to pay for it. You are paying for this coverage just in case something happens. If something happens to you and you have health coverage and you have been paying your monthly premium, then you would be serviced that way, So it's important to make sure that you pay that monthly thing every day. Like it's like a subscription fee to getting the coverage. You dig? Like you pay it just to make sure that your stuff is regular. Like a lot of people out there, they watch Netflix or Spotify or whatever or not, and you make sure that you make that payment if you want to watch TV. Same thing with health insurance. You make that premium if you want this health coverage. You did. Now, the next thing, and people tend to get a lot of these things confused and commingled or whatever, but the deductible and co-payment, okay? These are two different things. And the co-insurance, that's different than the co-payment. So the deductible, I'm going to start right there first. The deductible is what you must pay out of pocket. And that's before the insurance starts to help, okay? So just because you got health insurance doesn't mean necessarily that you're out the ballpark yet. The deductible is just like your car insurance. How you have to, if you ever got into a car accident before, and I'll probably talk about car insurance later because, I don't sell car insurance, but I know a little bit about car insurance just based on doing this. But the deductible and your car insurance, if you've ever gotten into an accident, you had to pay that deductible before the coverage would even kick in, okay? So that's what that is. You are paying your car insurance, and then you have to pay your deductible to make sure that the mechanic will take care of your vehicle. With health insurance, you have to pay your deductible before the doctor will take care of your body, your vehicle, if you will. So that's the amount that you have to pay. The thing about a deductible is it works like the lower the deductible, the higher your premium. The higher your deductible, the lower your premium. So if you were to have, I think I said that wrong. The lower your deductible, the higher your premium. The higher your deductible, the lower your premium. So basically, let's just say you had, and we're just using solid numbers, but let's say you had $1,000 deductible, you might be paying $300 a month for your insurance. On the other hand, if you had a $10,000 deductible, you could be paying $100 for your insurance or less, or $50. It just depends. But no matter what, you would have to pay that deductible before the insurance plan starts to work for you. So that's what that's for. You did. Co-payment, okay? The copay. Now, this is how much you pay for a service, whether it is you see a doctor, you see your specialist, your doctor, your PCP, your primary care provider, your specialist, your podiatrist, your psychiatrist, your ophthalmologist. The specialists usually end in that list. Word. Was it suffix? You dig? Typically, this is what you pay, like the $20 I was talking about earlier. $20, $100, $50. This is your co-payment. This is what you pay for your prescriptions. You would pay this amount of money as your particular price for your coverage. Now, if you've ever seen a doctor, been to a clinic or whatever, for whatever reason, without insurance, you know that they're pretty expensive. I had an issue. I had to go see a urologist, and I didn't have any insurance. And they wanted me to put down $300 as a deposit to see the doctor. And then they would take that $300. They would take whatever their services was out of that $300. And it took me literally like 10 months for me to get a check back for, I think it was like $180 because of them doing that or whatever. But instead, if I had a copay, I would have probably just paid the urologist, since she's a specialist, about $30, $40, maybe $50, and would have never had to worry about none of that at all. No reimbursements at all. So that copayment is your amount that you would pay to have any services, whether it be medical, prescriptions, or even dental. Co-insurance. Now, this is where it starts getting a little tricky right here after this part. The co-insurance, this is a percentage that you split with the company that you have insurance with after your deductible is met. So after you paid your $500,000, $2,000, $5,000, sometimes $7,500 deductible, then your insurance starts kicking, and they have what they call the co-insurance. Now, the co-insurance, maybe you've heard these terms like 80-20, 50-50, 70-30, 60-40. Those are your co-insurance terms. So you would definitely pay the lower half, like 80-20, you're paying 20%. And this is your responsibility to pay of the bill. Like I said, if you've been to an ER before without insurance and they charge you for XYZ, x-rays and yammograms and zippers and all those things, because you got stitches, you have to pay for each one of those services. X-rays, EKGs, MRIs, CAT scans, CAT scans, all of those things have separate charges, okay? And then they combine and you get this bill. With health insurance, what they do is they allow you, once you've paid your deductible, they allow you to pay a percentage of those fees for those particular services, okay? Let's say you had a bill that was $1,000 because you went in and you pricked your finger and it started bleeding and you needed to get a stitch or you need to get a tetanus shot or whatever it is. And your $1,000 bill, you're like, wow, this is crazy. I can't afford this $1,000 bill. If you've met your deductible before the year, and the deductible is usually typically for a year, if you've met that deductible, you are now into your co-insurance phase. And just for all intents and purposes, we're just going to say 50-50. So the insurance company picks up 50%, you pick up 50%. And so that makes your $1,000 bill $500. If it was 80-20, then that makes your $1,000 bill $200. That's your responsibility. That's what the co-insurance does. So if you have a breakdown of your plan, definitely look out to see what your co-insurance portion is. See how much you're paying for your services after you've met your annual deductible. And yeah, let me tell you about that, about the deductible. It's hard to say when you say it so many times. But the deductible is on a rolling year. Well, it's not rolling, but it's on an annual basis. So once you started your coverage, typically they continue for an entire year. So if you started in January and you move forward through, let's just say, August, and you've met your deductible, from August until the end of the year, you're in that co-insurance phase where you pay that 80-20, that's 30-70 or whatever it may be, or 70-30. And then once you've reached what they call the MOOP, maximum out of pocket, that is the maximum amount of money that you will pay for the entire year, period. So once you've paid your deductible, there is a maximum out of pocket or out of pocket max. That is when your insurance kicks in fully and it takes care of all of the coverage. So 100%. Typically, the maximum out of pocket is higher, sometimes twice as high as your deductible. So if you got a $500 deductible, your maximum out of pocket could be $1,000, $1,500. And truly, if you have a $500 deductible, that means you may be on the 80/20 coinsurance. So it'll just take you a little bit longer to reach that maximum out of pocket. You know, you paid that $500 for your deductible. That's cool. Now you're on this 80/20 thing. And unless you're seeing the doctor regularly based upon having pre-existing conditions, like such as, you know, just throwing it out there, cancer or kidney failures or autoimmune diseases, you know, you may not reach your maximum out of pocket. But some people reach their maximum out of pocket extremely fast based upon medications, based upon doctors. I've talked to people who've had 4 or 5 doctor's visits a month, who are on 8 to 12 different medications plus, and who not only do they see their doctors that many times, they have specialists that they see. And after a couple months, they've already reached their maximum out of pocket. You know, they've already paid their deductible. They've reached their maximum out of pocket. Some of these prescriptions, thousands of dollars a month. So like, yeah, that's it's not hard to reach a maximum out of pocket if you are indeed in need of health insurance. So yeah, I am going to stop right there. I figure that's enough for you to go over and repeat and get into the groove of what these things are and how these things work. If you have any questions, feel free to contact me. Drop a comment in the chat, wherever it is, hit me up. You know, follow me, NUKNOE.link, LINK. All the social medias, ask me some questions. I promise you I got an answer for you. I definitely do. And then also, you know, I am putting up a ebook I'm putting together. This one's totally free. I want you to download this one for free. And yeah, at worst, if I can't put it up for free, I'll put it up for $1. And this will go over all of these things and some more things that I'm going to go into a little bit later. And man, hopefully it just gets you an idea of how these things work. So without further ado, man, I appreciate you listening to me give you my spew on the health insurance. And you know, I have a lot more of insurances I could talk about, but we're just doing health insurance because I want everybody to be healthy out there. And yeah, I appreciate that you just got to this point listening to me speak on FRESHH Radio, where I bring you the family revolution, edutainment, health, and hip-hop all in one show. Y'all be smart, please.
Yeah. Hey. I know a lot of people cause I've been a lot of places. Might forget a name, but I don't forget faces. My game been tight for a quarter century, cause I still speak to people that I met in elementary. The only rule I follow to